Hello, ladies and gentlemen. Welcome to this presentation. I want to continue with community psychiatry from where I ended the last time I did the presentation. Um, we're going to continue with psychiatric deinstitutionalization. Okay, so we bring the presentation on. I just want to make sure that my mic is loud, so you'll hear a little bit of an echo. Okay, so please, if you are watching me now, you can ask me questions. For now, let me do the presentations. You can still type your questions, and I'll respond to them. Okay. Um, we defined what community psychiatry is. We defined institutionalization. We looked at mental health promotion, institutionalization, and now we're going to look at psychiatric deinstitutionalization. This is something also that you need to know under community psychiatry. Okay. Um, just a minute. I think the music is too loud. Let me just reduce it a little bit. Okay. Comments are welcome. Questions are welcome. So, psychiatric deinstitutionalization, this is where we are beginning from with this presentation today. So, what is psychiatric deinstitutionalization? Deinstitutionalization Okay, so deinstitutionalization simply means the discharge of patients from an institution. Okay, in this case, it's a psychiatric institution. So, to put an end to the exploitation that patients were suffering from in psychiatric institutions, um, to patients who are institutionalized, and to improve the quality of care to patients with mental illness, there was a massive discharge after the meeting, the conference that we talked about, after the suggestions were made that there should be an introduction of community mental health services at community level or in the primary health care setting. There was a massive discharge of patients from psychiatric institutions, okay, by countries who adopted that idea. So this massive discharge was named psychiatric deinstitutionalization or deinstitutionalization, and that is what we are talking about here. So if you hear someone or an examiner asking you a question that, um, what led to the introduction of community psychiatry? Okay, or it's the same question as what led to the institutionalization. Your response will be the same. Okay, the answers to that question will be the same. So if you are asked to say what led to psychiatric deinstitutionalization and what factors led to uh, the massive discharge of patients from psychiatric institutions, the responses are the same, and we are going to look at those things later in the presentation. So this process led to deinstitutionalization, of course, um, and some of the hospitals were closed up, and some they just reduced the number of admission beds. Okay, they reduced the number of patients who are admitted in those hospitals. Okay, so that is about psychiatric deinstitutionalization. Let me see something here. I want to try out something to see whether okay. Right. I'm still learning the system. Okay. So other reasons for deinstitutionalization included the following. So some of the reasons why they introduced deinstitutionalization in the psychiatric ward as follows. The high cost of institutional care. There was a high cost of institutional care. Imagine a psychiatric institution or a hospital where patients are rarely discharged, but you keep on admitting your patients. Okay, so because of that, um, psychiatric patients were very expensive to handle, were very expensive to treat in the hospital because they are not like prisoners who can go out and work. These are patients who just have to be admitted in an institution, and they are feeding. It's the responsibility of the government to feed them. Okay, so it was so expensive for the government to feed these patients, to attend to their needs. Okay, because it's not just feeding. Okay, they need other things as well, social amenities and everything. It was so hard and expensive, costly to handle or to manage these patients in psychiatric institutions. Discovery of psychotropics, right? Uh, the discovery of new drugs that could be prescribed to the patients and given to them so that they take while they are at home is also one of the factors that led to the discharge or that promoted the introduction of community psychiatry or that promoted deinstitutionalization. Okay? Discovery of psychotropics, new drugs that will be prescribed to patients and they take them home and the patients will only come back to the hospital for drug refill and review. Okay. Civil rights activism, the incoming of NGOs that were advocating for patients' rights, that were advocating for good mental health care services for these patients. It's also one of the factors that led to psychiatric deinstitutionalization. All right, so these are some of the other factors that led to psychiatric deinstitutionalization. In case you are asked that question, please do not forget we have just about 4 points. Okay, and the question can be asked um, in two different ways. Someone may ask you that what are the factors that led to the introduction of community psychiatry? It's the same factors that led to deinstitutionalization, the same factors. So, following deinstitutionalization or deinstitutionalism, mental annexes were opened at general and central hospitals. So these mental annexes were simply departments in a general hospital where psychiatric patients were nursed. And usually they nursed female patients in these, in general, in these mental annexes. This led to people with mental illness being returned to the community to live there. Right. So after the institutionalization or introduction of community psychiatry, patients were returned to their community and to be nursed in the comfort of their home. And this is what happened. But people in the community were not prepared for the influx of patients from mental institutions, which led to some undesirable effects. So there is a question that we ask to say, what are the effects of psychiatric deinstitutionalization? Or what were the effects of psychiatric deinstitutionalization? Right. So this massive discharge of patients from psychiatric institutions to be nursed in the community required a lot of activities or a lot of requirements, a lot of things in order to manage these patients within the community. Training of healthcare providers, community healthcare providers, training of professionals who are going to handle these patients in the community, and also making sure that the community itself is empowered with knowledge or they are educated about mental illnesses. Okay, we know that the community has a lot of stigma towards these patients. So discharging these patients back into the community um, brought in undesirable effects on the patients themselves because the community was not ready to receive these patients. The community was not yet oriented on how to handle these patients. Okay. Effects of deinstitutionalization. So the effect of the massive discharge of patients from psychiatric institutions, barriers of social inclusion, stigma and prejudice. Okay, so this deinstitutionalization led to um, barriers of social inclusion, right? Patients were not included in psychiatric institute in social activities, in certain activities within the community that they were entitled to be involved in. Okay, so instead of including these patients in activities that were supposed to be included in, they were socially isolated by the community because the community was not ready to accept them. Right. Poor social skills, for example, um, inappropriate behaviors in public places such as shops or restaurants or churches. So patients themselves were not yet ready. They were not empowered with skills such as social skills on how to to um, to behave when they are when they get back into the community. Right. So patients were not empowered with those social skills to be reintegrated in the community. So their social skills were poor and they, they acted in a manner that was inappropriate in public. Right? For example, um, urinating in public, or yeah, some walking naked in public, fighting, being aggressive, shouting, in all that, just behaving in an acceptable manner because they were not oriented, they were not trained on how to carry themselves in the community. Okay. Um, the community was not ready to receive patients, so they got admitted into state hospitals. And also, the community being not ready to receive these patients, patients ended up being readmitted in state hospitals. Some ended up in group homes, and some ended up in prisons. Okay. Some other patients fell into the criminal justice system because they committed offenses. Others became homeless or vagrants. And in Western countries, others were taken into nursing homes, especially the elderly. Okay. Um, this flood of patients led to advocacy efforts and movements by NGOs, right. Um, that was a network breakdown. So this flight of patients leads to advocacy efforts and movements by NGOs, by consumers, families, mental health professionals, and other NGOs. Okay, so the patients, the crying of these patients, the plight of the patients attracted some advocacy efforts from their family members and from NGOs. Okay, the patients really needed a lot of help. They needed advocates. They needed advocacy efforts for that, so that their services might may improve. Okay, so psychiatric patients were calling out for help and for the need of um, psychiatric services to improve. And NGOs came in, the patients' families, and other mental health care professionals. Those who were interested in patients suffering from mental illnesses. They started uh, talking about the need to improve mental health care service provision. Okay. Uh, Community secretary in Zambia. Um, okay, so community secretary in Zambia was introduced in the year 1979 after the conference that was held in Alma-Ata in 1978. So in Zambia, they decided to adopt, the Ministry of Health decided to adopt the suggestions that were made in the Alma-Ata General Conference about mental illnesses, and, about how to handle psychiatric uh, patients. Right. So in the measures were put in place to develop community mental health services through integration into the existing primary healthcare system as proposed at the conference. Right. So in since in Zambia we already had this primary healthcare system, measures were put in place, of course, uh, to develop community mental health services through integrating it or integrating these services in the primary healthcare setting. So they decided to send um, uh, in some enrolled psychiatric nurses into health posts, into clinics and health centers, because the primary healthcare system in Zambia is involved with those. Okay, the health posts, the clinics, and the health centers, they are, and the district hospital actually, they are the ones that provide primary healthcare service, but it begins from the health post. Right. So they made sure that the Ministry of Health made sure that it sent psychiatric, it sent nurses to go and save uh, at these health um, health posts in the community to attend to patients who are being sent back home from psychiatric institutions. Okay. Previously, no enrolled psychiatric nurse was sent to a place like a health post. It was too small. A health post previously was just managed by a community health volunteer, okay, HR. But now we have nurses there. We have nurses who manage these um, facilities this time. Okay. Um, It, it was proposed that there should be a mental health component in which community health workers with support from neighborhood health committees and taken to guidance from mental health professionals will base their work after a 6-week training. So in Zambia, they had to introduce some volunteers called community health workers. These were working hand in hand with the neighborhood health committees, and they were trained. They were having a short training for 6 weeks, and yes, from mental health professionals. And after graduating for 6 weeks, they would be sent back to their communities to go and serve there and help and manage psychiatric patients within their community. The mental health policy of Zambia, which guides the development of mental health services in the country, states that disabilities that result from neurological, mental, and social disorders shall be reduced through community rehabilitation by ensuring that, okay, mental health services are delivered to the community. Secondly, services recommended in the mental health policy are implemented through strategic plans and programs that address specific needs of the community. Right, so let's continue. Sorry, my network is tripping. I have no idea why it's doing this today, tonight. All right, so um, this is what the policy states. So the second point is that services recommended in the mental um, services recommended in the mental health policy are implemented through strategic plan, which ensures that funds for community-based mental health activities are available. Okay, so um, the policy simply states that the implementation of these recommended mental health services shall be done through strategic planning, okay, which will ensure that funds are available. And that is why every institution, beginning from the health post, they usually plan for these healthcare services. They have what we call uh, um, annual work plans, where they need to sit down and plan for what kind of services they need. Actually, these plans are made for the next 3 to 5 years, and then they have to send recommendations from the health post. They'll send recommendations. They'll send their plan to the district health office. The district health office will now deliver to the province, then to province will deliver to whoever makes the policies, right? Whoever makes the policies and whoever funds these services. So there is need for this strategic planning. So as a nurse, you need to expect yourself to become a planner. You need to expect yourself to be planning when you get into the system. So such services include uh, conducting the public educational programs to create awareness of mental health issues. So you have to make sure that you create awareness of mental health issues within the community. And these activities are a recommendation in the mental health care policy, providing care and support skills to neighborhood health committees through short courses and supervisory guidance. So, as a nurse at a health facility in the community, you need to provide this support to the neighborhood health committees, empower them with the knowledge they need on how to handle patients within the community, and subject them to short courses and supervisory guidance as a professional nurse. Networking with NGOs with similar interests to promote mental health and prevent mental health problems in communities, such NGOs include user and careers groups. Right. So, as a nurse, a professional, you need to have that rapport with NGOs with who have similar interests to help patients with mental illnesses within the community. So you should look for NGOs actually. No one will approach you. No NGO is going to approach you. You need to look for them and seek for their help as a nurse at a facility. All right. So these NGOs are simply your partners that you'll be working with in order to meet the demand. Okay, to meet your patient's needs. Sometimes it's the NGOs that will actually sponsor these short courses for community health volunteers and all that. Okay. The roles of mental health workers include the following. So these mental health workers who are volunteers, these are some of their roles in the community. You need to know these roles. It's very, very important because we have questions about this as well. So conducting mental health education in communities, it's one of the roles of these community volunteers. Okay, conducting mental health education, conducting mental health education in communities. So these community volunteers, the community mental health workers, they are one of their roles is to conduct health education in the communities, to educate the communities about mental illnesses and how to deal with patients who are mentally ill within the community. This will help reduce stigma in the community when this education is provided. Identify and refer patients or persons with emotional problems, serious mental illness, epilepsy, learning disabilities, and behavioral problems to health facilities. So the other role of these mental health volunteers is to carry out an assessment of their community and find out who is a patient and who is at high risk of suffering from a mental illness and refer these persons to the health facility for further management or counseling. Okay. Education encourage patients in the community to comply with medication and keeping of review dates. So another role of these community mental health workers is to encourage patients in the community, to encourage the already patients who are on treatment to comply with the medication or with the treatment that they have been prescribed so that they do not have unnecessary relapses. Okay. We also encourage them to keep review dates. Actually, the community health workers will remind patients to go to the health facility for review. Usually, they also encourage acceptance of patients within the community. So they also encourage the community members to accept these patients as part of the community. They collect and complete simple data about, they collect and compile simple data about mentally ill individuals in the community. So these volunteers also uh, deal with documentation. They collect data in the community, they compile it, and they report to the health facility to a professional healthcare provider. Right. So for these community volunteers to perform all these functions, they need to be guided and supervised by a professional mental health care provider who is a nurse at the facility. So for these mental health care, for community mental health care services to be successful, they are provided um, at about three levels. Okay, so we have levels of intervention in mental health or in community psychiatry. So levels of intervention and taking a definite step to reduce symptoms of to reduce symptoms or keep mental illness from occurring include primary, secondary, and tertiary. Right. So the provision of mental health services in the community is at three levels: at primary level, secondary level, and tertiary level. Or primary prevention, secondary prevention, and second and tertiary prevention. So we are going to discuss these three levels in the next presentation and see what they are exactly. And so in the next presentation, I'll talk about what type of interventions are under primary prevention, what type of interventions are under secondary prevention, and what type of interventions are under tertiary prevention. I do not want this video to be too long. It's long already because I was having issues with network. I'll make another one, which is going to be part 3. Thank you so much for listening. Um, Stay blessed. Please subscribe to my channel if you are not yet a subscriber.